Catatonic schizophrenia is a subtype of schizophrenia. It is characterized by excessive movement without a purpose or no movement.
Oh, Mr. Gordon, is it?
It is.
How are you doing
Peoples, I assume?
Yes, you can just sign in right there for me.
Very well.
Alright, if you can just go over here for me.
Sure.
If you'd like to just fill out some of these papers for me. That'd be
Absolutely.
terrific.
Happy to.
I hope we can accomplish a few things today concerning your issue.
Yes, I like that very much.
I see on your chart here that you've been acting differently than you normally do.
Somewhat. I don't see much of a change in my behavior. My family forced me to come meet with you.
Well, whether it's necessary or not, I think we can make the best out of it.
Sure.
So I noticed you came walking in on your tippy toes. Is that normal for you?
Not exactly. I didn't do it as a kid. I just recently started doing it now for some reason.
Well, what else has been going on?
Nothing else is going on. Nothing else is going on. Nothing else is going. Nothing else is going on. Nothing else is going on.
Will has just shown the symptom of echolalia, which is when someone repeats what the other person said multiple times.
Well, I just see that you repeated what I said to you. Why did you do that? Will, are you there?
Will has now shown the symptom of mutism, which is when someone refuses or cannot speak.
Will, why aren't you responding to me?
Sorry, I don't know. It just came over me. Sometimes that happens every so often.
Interesting. You might not like hearing this, but from what your family has told me, there's some other symptoms.
They probably lied to you. I'm fine. I really don't need help.
Will, I'm not trying to start any conflict here. I'm only trying to help you.
I understand, doctor. Just I'm fine. I don't need help.
I believe you are fine. I just want to make the best out of this.
I suppose.
Now, tell me about your childhood.
Well, I grew up in Illinois for most of my childhood. I was 8 years old when my parents died, and after that, I was moved into foster care. And you can, I'm not trying to sound like a sap, but you can ask my sister and my foster sister that my foster parents were pretty abusive.
Will has just shown the risk factor of a stressful environment at a young age and being conceived early on with older parents.
Don't respond if you don't want to, but how abusive?
Well, without sugarcoating it, it was mainly verbal, but as I grew up in the foster home, they gave me more and more responsibility. So as a kid, I made some mistakes, and that's when it turned physical.
You don't have to say anymore. I understand what you mean.
And thanks, those were dark times.
Would you like to schedule another appointment? I think it'd be very beneficial for you.
I suppose I will. It'll keep my family off my back.
Would you like sometime next month, perhaps?
Fine with me.
Alright. It was good news. Okay.
Pleasure.
See you sometime next month.
Ben notices that Will is showing the symptom of wave flexibility, which is when one assumes an unnatural position and does not notice it and cannot fix it.
Hello, Mr. Gardner. How have you been lately?
Alright.
How so?
Well, my condition's gotten a little worse. I haven't had as much control over my body as I used to. I think my family might be right. There's a little something wrong.
Well, let's sit down and figure this out. You sure you wouldn't like to sit?
Will is showing the symptom of negativism, which is when one refuses to follow directions.
Well, how have you been since last time I've seen you?
Look, it's not your business, alright? I can't believe that I agreed to meet with you again.
Will is showing agitation, which is another symptom of catatonic schizophrenia, and he shows agitation for no apparent reason.
You just admitted something is wrong. I'm trying to solve that problem.
No, I don't think so, Mr. Peoples. Goodbye.
Will, you want me to tell you what's wrong with you?
What is it?
As your psychiatrist, I believe that you have a condition called catatonic schizophrenia. It is a mental disorder in which a person has excessive movements or little movements. I'm not trying to say this to scare you, but I think we can fix this.
Well, what would I have to do if I had this disease?
Well, I want to start you on some medication. The drug is called atypical antipsychotics.
Atypical antipsychotics were introduced into the 90s and are meant to target dopamine production in the brain, which allows for movement but also prevents hallucinations and other symptoms.
What's the catch with these?
Well, the side effects are constipation, anxiety, or you might become insomniac.
I'm really not sure. I mean, I don't even think I'm in that bad a shape right now.
Well, I'm not trying to waste your time here. If I write you a prescription, will you be able to pick it up or have someone pick it up for you?
Yes, I'll try the drugs out. You really think they'll help?
Yes, I do.
Okay, Dr. Peoples, I'll do as you command.
Alright, now let's schedule one more visit. I'd really like to check up on you in a few weeks.
Alright, I guess that's okay.
Fantastic. Let's wait 6 weeks and then come back.
Sounds good.
Alright. Have a good one.
Ben still notices that Will is showing signs of way flexibility, same time as the last visit.
Hey, Will. How's the medicine been working for you?
Well, it stopped working.
That's pretty odd.
Will has just shown the symptom of ectopraxia, which is when one imitates another.
I see you have decided to sit this time. Well, the next option is electroconvulsive therapy for you.
Electroconvulsive therapy has a success rate of about 80% in catatonic schizophrenia patients.
This is a little more extreme version, but it has a high success rate in people with your condition.
Will is showing the symptom of a stupor. This is one of the most severe and noticeable symptoms of catatonic schizophrenia.
I know that you need help. That's all I'm trying to do for you.
Sorry, what were you saying?
Would you like to be better?
I'm at the point right now where I'm willing to try anything to get rid of my problem.
Electroconvulsive therapy. It's a major therapy that sends shocks through your body and basically resets you.
Scary as that sounds, I'll go through with it.
It's great to hear, Will. Trust me, this is the right decision. I'm going to get in contact with some specialists.
Okay, just please let me know when you get in contact with someone. If you can't get in contact with me, call my sister. She's on my emergency contact
Will do.
list.
Next time I see you, it'll be much better.
Let's hope so.
After several treatments of electroconvulsive therapy, Will is back.
Dr. Peoples, it's good to see you.
Well, we don't have an appointment scheduled. Why are you here?
Well, I came here to say thank you. Thanks for not letting my condition get any worse and curing me.
Well, that's what I'm here for. No problem.
I want to say thanks again, and I better be going.
Alright. Take it easy.
Will's hand was perfectly fine because the treatment worked and he is now better.
It's raining men.